Hello, so this is just a word about the two types of pain and whether you're familiar with those and what they mean, because I think there's a lot of confusion around what pain is and what different types of pain are, how they're defined by doctors as opposed to by us, by like normal people, right? And what those definitions might mean. So there are, and pain specialists in clinics the world over will tell you this, two types of pain. Pain is fundamentally either acute pain or chronic pain. Now, acute pain is usually, anyway, not mysterious in its cause. So, you might need to have blood work or whatever to identify the cause, but fundamentally, acute pain comes from something that is an identifiable medical or structural cause. So, for example, a broken bone or a dislocated joint, okay, will cause pain. A bacterial infection or an open wound, organ damage, so something like appendicitis, and cancer too counts as acute pain. Chronic pain covers the other type of pain. To be in chronic pain does not mean that you have a chronic pain syndrome, although it might do. Right? Chronic pain covers things like lower back pain, sciatica, hip pain, neck pain, a sore foot, okay, that goes on for some period of time. So technically, chronic pain is any other pain than acute pain that is ongoing for more than 3 to 6 months. And while it can sometimes have a really clear cause, and I'll talk about that a little bit, its cause is often not clear and not easily identifiable. And this is where, of course, a lot of the problems come up, not just with how to treat it, but with how we feel about experiencing this ongoing pain. So imagine if you have a fall and you twist your ankle badly and you will create tissue damage, right? This will cause you acute pain at the time and for some time afterwards. And then over time, as your tissues and your joint mend themselves, knit themselves back together, then the acute pain will ease off and you will recover. And then you might, or you might not, there's no simple answer to this, continue to experience pain after that tissue damage created by the ankle twist has gone. And that would be chronic pain. It's also chronic pain if someone has ongoing pain from an undetermined cause or a less obvious cause. So it might be lower back pain, right? Neck pain. It might be diagnosed as some kind of chronic pain condition, but that doesn't really clarify the cause. So ME, fibromyalgia, that kind of thing, that would definitely be chronic pain. Despite this, despite the fact that there are these two types of pain, many people, including very many doctors, tend still to look for a cause, right? A single cause of pain or a few causes that come together to create pain, especially chronic pain. And this causes problems of its own, many of which I see in my clients, right? They're suffering from that lack of certainty. Because the idea that there is a cause or a couple of things causing pain, especially chronic pain, promotes this idea that chronic pain has a single cause. It suggests that somehow if the right cause was identified, if you had some kind of really specific diagnosis that the doctors have somehow missed, then all would be well. And the idea too, it promotes this kind of alternative problematic idea that if doctors cannot find a cause, a medical cause, a structural defect, then the problem is seen to be as psychological or maybe even imagined. And that brings with it a whole host of other problems. And culturally, we see this with some of the attitudes towards chronic pain conditions. So I refer to this guy in my three-part series on the truth about pain, Dr. Lalkin, who works as a pain specialist in Manchester. And he says, right, the most common understanding of pain, ongoing pain, is that it's due to undiagnosed injury. And that again suggests that people tend to go down the rabbit hole of blame, right? They blame their doctors, they blame their therapists for somehow not identifying the problem or not giving them the treatment they believe they need. Or It can create in us self-uncertainty or self-blame. You might blame yourself and wonder if your pain isn't somehow all in your mind or conjured up in your imagination or from some psychological source. And all of these approaches, I think, are really problematic. And these are things that I really try to address in the work that I do with my clients, especially because I experienced a whole bunch of these, feeling like I didn't have the right diagnosis, doctors feeling like they couldn't find the right diagnosis and being frustrated, therapists feeling like they could do something for me and then it doesn't work, and me ultimately thinking, maybe I just can't relax, maybe there's something wrong with me, maybe it's all in my mind. Anyway, it's interesting that pain specialists nowadays, right, often suggest that chronic pain arises where nerves aren't working properly. This is a really typical way of them describing chronic pain. What's interesting is, if you read the literature, that mostly they can't specify what's happening to the nerves. They also can't provide effective treatment. A lot of pain specialists also agree, despite this, that medical and surgical interventions or treatments are relied on far too heavily. They're especially concerned about painkillers because those mask pain, don't actually address pain. And there's this general kind of concern around the idea that medical, surgical treatments just rarely work, right? They don't address chronic pain. So the figures show that you might have back surgery or knee surgery, and the surgery is a success, but the pain stays. That's the kind of thing I'm talking about. There you've tried to look for the cause of the chronic pain by saying, oh, there's a disc that's moved slightly in the back, or there's a problem with the ligament in the knee, and you surgically correct that. And what pain specialists see very often, and what spine surgeons see and orthopedic surgeons see, is that the pain doesn't go away. So they have fixed a mechanical problem, a structural problem, but they have not fixed the pain. What that tells us is that the defect, the structural defect, was not the cause of the pain. I do talk in that 3-part series about what that means, right? Pain specialists are aware that we experience pain in the brain, and I talk about that more there. That's not my focus here. But I would say generally what's interesting is that pain specialists, right, in 2022 also tend to agree that they really don't understand chronic pain fully, or really how pain operates at all in the nervous system, not fully. Going back to Dr. Lalkin, international specialist, in 2021, he wrote that we, meaning doctors, right, medical profession, pain specialists, we yearn for a biobehavioral model to explain why chronic pain develops. He also notes that in someone with chronic pain, curing the nervous system is not feasible given our understanding of pain. His idea being that that might change in the future as medical science and psychiatry advance. So my point here, the reason I do the work I do, is that this was the same situation that faced Thomas Hanna in the 1980s when he developed Hanna somatics. And his point, my point, is that neuroscience, medical science as we already have it, does have the answer to chronic pain. It really is based in neuroscience, how your brain and your muscles interact. The only difference is the perspective that you take on medical science, on neuroscience. If you do continue to treat the body as if it can be fixed by someone external in every case, then chronic pain doesn't make sense because it can't be identified and it can't be fixed. If you take the perspective that in some cases, pain can only be resolved kind of with the engagement of the person who's in pain, because they need to address their own experience and make changes in their own brain and their own muscles, then everything changes. Then chronic pain not only makes sense, but you can get rid of it. And I lived this experience, right, of having chronic pain for more than a decade and getting rid of it. I see it in my clients. So it's not just a neuroscience theory, it works. And I think it's interesting, it's ironic that, again, pain specialists like Dr. Lalkin do call on us. They say, you know, we shouldn't treat the human body like a machine, like it can just be fixed by someone. But actually, they're still kind of treating the body like a machine because they're saying, oh, we don't really understand it. And really, what clinical somatic education does, what I do in my Soma Essentials program and seeing clients in person, is say, well, we do understand where chronic pain comes from and we can do something about it. There's nothing woo-woo, there's nothing kind of mysterious, really. It is how your brain operates to create movement and tension in your muscles and what can kind of mess that up, basically. We go in, look inside ourselves to see how that's been messed up in our particular body and learn different ways to release it. Not by mind over matter or by, you know, using willpower, but by using movement and awareness of our movement. At the base of the work that I do is the idea that when your brain quite literally forgets how to move you efficiently, that is chronically painful. That is chronic pain. So the kind of quick run through, going back over this, acute pain comes from a usually obvious or at least identifiable medical cause, which will be damage to your tissues, to your bones, internally or externally. Usually acute pain needs medical attention, although that could include self-care at home. And acute pain is pain that normally will resolve within 3 to 6 months in most cases. Medication, surgery, looking after yourself with home remedies, therapies, can all help with acute pain, no question about that. Chronic pain is quite a different fish, okay? It comes from a number of causes, but a lot of it, the majority of it, in my experience with clients and with myself, is that chronic pain is fundamentally caused by tight muscles, staying tight out of habits that are formed in your body, your brain telling your body that that's the way it should be, forgetting that there are better ways to be. Those habits might come from repetition. So it might be ongoing stress. It might be that you work at a desk all day and you're kind of just getting into a bad habit that's creating tension and pain. It might be from a habit like carrying your bag on the same shoulder for years. That can create chronic pain that shows up not on your shoulder necessarily, but all over your body. And it could be from a stress or a specific trauma in your life. So something like an old injury, an assault or a surgery can also show up as chronic pain even years down the line. So in the end, most often self-care doctors or therapists can help you with acute pain. If the pain continues or if you have chronic pain from something less obvious, then that is when clinical somatics can help.